Fraxel light with PRP or PicoSure with subcision for ice pick acne scars. I want to see if Fraxel light with PRP might be an option to minimize ice pick acne scars. I know CO2 laser is the best option, but I don't want to go that route yet with the long downtime. My acne scars are noticeable around my cheeks. I've tried PicoSure twice, with subcision done once. PicoSure didn't seem to reduce much of the ice pick scars so far. I want to be somewhat cost conscious. PicoSure plus subcision is estimated at $900, while Fraxel Light with PRP is $400.
Thank you for your question. You submitted a limited photo showing the area of concern, or one of the areas of concern, and you described a couple of options that you've undergone, as well as choices that you have, as well as some prices for treating acne scars, including ice pick scars. And your question is about the role, of course, of PRP. Well, I think that what you're getting probably lost in, as many people do, is trying to figure out the right technologies that and in what combination will give you the best results. When I see a patient who has had acne scarring, I first begin by telling them that one key characteristic of many people with acne scarring is that they frequently bounce from one doctor to another looking for the next best thing. And at some time they'll learn about one laser, and then they'll go there, they'll get the treatment, then they'll go to another place because they heard about another laser. The reality is that it takes one treatment, one modality, or one combination doesn't always work the same way for two people. Acne scarring has a lot of variables and complexities that have to be addressed. As you mentioned, there's subcision, there's platelet-rich plasma, there's the use of fillers. When I meet with a patient, I tell them that if you're going to work with me, then we have to be committed to doing a treatment, seeing how you respond to it, and then doing another treatment after that based on that response. And when you shop technologies and prices, you're going to have a lot of disjointed and disconnected treatments, and you're going to have a lot of doctors who, maybe if their main thing is to sell that particular procedure, they're going to sell you the procedure. My philosophy is I want our patients to feel that I'm committed to taking care of them and helping them understand what they need. And of course, we figure out what the right budget is. PRP is a great solution to help people, or a great technology to help people with acne scars. I've used it very successfully in scarring. I use it in acne scars. I combine it sometimes with acellular matrix. I do combine it with subcision. I often do combine it also with hyaluronic acid fillers. So I think your job is to meet with the doctor and really get deep in a conversation as to what their vision is based on what they would recommend and what the choices are based on the results. If the results go in the way you want, or if the results don't go in the way you want. But sticking with one doctor is much more important than having me just tell you, well, this laser is better than that laser. It's not a laser, it's a tool. These are all tools that the hand of a doctor, especially one with experience, can be used effectively. But the patient also has to be committed to a long view, because there's no one-time treatment that's guaranteed to make all the acne scars look good at one time. So I hope that was helpful. I wish you the best of luck. Thank you for your question.